Hey everybody, I just figured I would hop on with another update. I met with the surgeon last week, and that was a hopeful, left there feeling very relieved, very hopeful. But then it was followed up with a wound care appointment the next day that then left me really anxious. So just figured I'd kind of fill you in on everything. I waited until this week because I had a appointment with the infectious disease doctor yesterday. And so that way I had everything as up to date as possible um, before making an update. And then I plan to be off through the new year. So there shouldn't be any more news, nothing, hopefully nothing, because if something happens, it means that something drastic has happened, and yeah, hopefully that's not the case. Um, Basically, upon meeting with the surgeon, when I went in to meet with him, I still had that original wound here that we're keeping, it's getting checked every week at wound care. Well, before I could get to the surgeon, another wound opened up below it. Basically, I think because of all the pressure in my face and the way my face is healing, I've noticed at first a small little bump, just like right here underneath that top wound. And I could kind of touch it. I was trying not to touch it, but I could touch it and it would squish and go away. So I was like, is it fluid? Is it air? I didn't know. But then the next day, it got really big and my skin hurt so bad. I mean, really bad. And I have a pretty high pain tolerance. It was rough. And I was like, and it had a white, not a white head on it, but a white area, I think, from just how much pressure was being put on that skin. And so I was like, I either need to help it along or something has to happen. But it did eventually kind of pop, and it was air. It was nothing but air. And then a little bit of fluid came out at the end, but all it did was let out air. And then my skin was all crinkly because it had shrunk down so much after it had gotten stretched out. Um, so he saw it. He decided to take a culture of it while we were in the office. But basically what he said is, I still can't see any hardware. So I have hardware in my face where they fused my skull back together. I no longer need that hardware. But what could be happening is that this side where the skin is also so compromised, the hardware has basically created what they call a biofilm around itself that's kind of like an infection, but it's also warding off. It's trying to protect itself. So it's also very hard to treat with antibiotics. It rejects a lot of antibiotics. So we found that out in the hospital, that there was some slight staph when that first wound opened. I had some staph infection. So they put me on IV antibiotics that I came home on and gave myself IV antibiotics. Went off of those, and then they put me on these new antibiotics, and they want me on them for 3 to 6 months, potentially even longer now, basically to suppress any infection that could be coming, in hopes that the wounds clear on their own. But after speaking with the infectious disease doctor yesterday, he believes that eventually the hardware is going to have to come out. That right now we're just doing everything we can to keep the infection from not getting worse. He said it's very light. The amount of staph showing up on the culture is very light, and everybody has staph on their body, in their body. So it's not like it's out of control, but either way, the wounds are not healing well. So We're just continuing to keep an eye on the wound care. I'm continuing to go to hyperbaric oxygen therapy, which is helping, but it's a very time consuming. Anyways, that's not here nor there. That's a side note. But so my surgeon said, if the wounds do not close, meaning the ones here in my forehead, we will remove the hardware. As you can see, another new update from the last update is that yes, there's another hole in my face. And if you can tell how excited I am about that, that's how excited I am. So done with having holes in my face. I just don't get it. We did a whole new flap surgery to hope that I would not have a hole in my face. But because of the radiated skin, which is what the surgeon was worried about from the beginning, and doing surgery so quickly after my first flap surgery, so there was only 6 months between my 2 flap surgeries, yet again, and this is almost the exact same place the other hole was in. The other hole was a little bit more over, but yeah, it's another hole. And so for some reason, that meat just doesn't want to stay stuck up on that part of my skull, whatever, where it's supposed to stay. I think because right now, that you're hearing is me breathing in and out through my hole in my eye, but I cannot breathe out of this side of my nose because all of this bulk, all of the meat that they took from my thigh is currently still sitting in this nasal passage. So until this continues to shrink, it's hard to get any of the stuff that's still coming out of my face as it heals. It's hard to get any of that out of this nostril. And so my body is looking for ways, meaning it used these pathways at first. Now it's using this pathway to try its least resistant way to get the fluid out of my body. And so, yeah, hopefully as it shrinks and I can breathe out of this nostril. So if I tilt my head, then I can get some air in and out of this nostril. So when I do my nasal rinses, I tilt my head and thankfully stuff will come out of this nostril. But most of the stuff comes out right here. So, yeah, that's continued greatness. But yet again, at least this time, so the surgeon said they will be able to take out the hardware if needed. And then this, if the hole doesn't heal on its own, which I'm not thinking it's going to, but if it doesn't, then what they do is they'll take this, there's so much bulk now, they will take it, lift it up, fill in that space, and then suture it closed. And what that looks like, I don't know. I don't know if it's as simple as just pulling it and suturing it on the outside. My guess is that's not the case. He's probably going to want to put some meat and adhere it up here, because what they're wanting to do eventually is not have any kind of connection, sinus connection from my sinuses into this cavity basically that's here now. So that hopefully I'll just be able to flush in and out. Nothing will try and be pushed up here. But we'll see. Either way, unless he is forced to do something because of some unknown issue that comes up between now and then, my surgeon doesn't want to touch it anymore, do anything else for at least 18 months. He wants me to finish the hyperbaric oxygen. I have about 40 sessions of that left, and then give it 18 months for my skin to fully heal before he does any other procedure, which, seeing how fragile my skin has been after this, I can understand why he wanted to wait as long as possible before doing this flap surgery. Obviously, it is heavier, so it's pulling, gravity's just pulling on it, so that's not doing me any favors. My body just wants to seem to find its most or quickest escape route, I guess, so that's not doing me any favors. Yeah, that's where we're at. We're just kind of plugging along, waiting to see what's going to happen with everything. I have another follow-up with my surgeon in mid-January, so I'm doing about every 6 weeks meeting with him unless I need to go in for something that I'm, that's making me nervous or anything like that. But the rest of it is healing really well, actually. Wound care is very impressed with it. He's impressed with how the rest of it's healing. It will continue to shrink. And my hope is it just gets small enough for me to put a sticker back over it. I think I've shared that before, but that's my hope. I'm getting more and more comfortable about going out in public with not this exposed, but I will drive around without anything covering my face. So I'm sure I get some people driving by that are like, what? But if I'm going in anywhere, I cover it up with either just a bandana or a full kind of head wrap thing that it can drape down below my eye and fully cover it. So yeah, that's the medical update, I guess. Mental health update, life update is we're doing well. I still have my moments where, last night, I was very discouraged about the whole, but I don't feel that way today. It's just, at least there's options. At least it's not like, oh, you're going to have to get a whole nother skin flap again. It's just, we have options this time. Do I want to have either of those surgeries? Do I want the hardware removed? No. Do I want to have this pushed up, stitched up, done whatever? No. So I hope that, God willing, these things do heal on their own, and hyperbaric really helps with that, and I can move along my merry way. But just knowing how kind of everything's gone up to this point, I'm resigning myself, I guess. I'm preparing myself for the fact that I think both things are going to have to happen. Especially since I am on the antibiotic and it's not really going away, and I don't want to stay on antibiotics for the rest of my life, just trying to suppress this potential infection. So we shall see. But otherwise, we're doing good. We've got the Christmas tree set up. It's a bit of a mess in there, but I don't know if you can see it. We've got our Christmas tree, and setting that up with baby girl was, just so good for this mama's heart. This whole season, it's just been, last Christmas was really rough. Really rough. We were trying to find joy everywhere we could. We went camping for Christmas, which is something that brings us a ton of joy, and we did the best we could. But we knew we had my eye removal surgery looming. We knew it was going to be my last Christmas with both eyes. I was just coming off chemo, and so there was joy, but there was a lot of mixed joy with just pain, hurt, fear, all of those things. And there's still some of that this year, but the joy is so much bigger. So just know, if you're going through a really hard season this year, if this Christmas season for you is just one that you don't want to do, that's okay. That's why Jesus came, so that we can have those hard seasons and let ourselves be broken, and just know that next season, the joy may be stronger than everything else. And that's kind of where it is for me right now. I just marvel at her. She's doing so sweetly with the Christmas tree. We were worried because she's walking, she's all over. So we specifically put all the non-glass ornaments on the bottom. I know some people like just don't do ornaments on the bottom, but I was like, I want her to be able to engage with the tree, really start to understand what things are. I think that helps her. And she's done really well. We told her, you can touch the ornaments. I'm also not opposed to her touching the tree, touching the ornaments. She just can't pull them off. And she has done so good. If she'll touch one, and if it accidentally falls, because they're just not on there well, oh, and she tries to put it back on, but basically just lays it across a branch until I can come back behind her and put it on. And we met Santa, which was fun. She's not so much a fan of Santa, but she did sit next to him. Was not going to sit on his lap. Tried to, and was like, nope, Mom. But did sit next to him, put on some sunglasses, and they had a little photo session. And she's been helping me kind of wrap presents, and that's been sweet. We wrapped a big present for Dad, and she went and slid it under the tree. And so just getting to watch her do that and see how she's kind of putting those things together, just the joy is bigger this year. I just feel the Christmas joy again. And it's actually been a while since I feel like I felt this much Christmas joy. And so much of it has to do with her. I mean, really, it all has to do with her. Thank God for her. God knew we needed her, because I can't imagine not having her here this year to make this just so special. So we're doing good. I pray the same for all of you, for your families. If you are going through the thick of it, my heart is with you. If this is your first season with someone not here who should be here, my heart is with you. It's hard. I lost a brother, and I remember those first, gosh, I think it was like the first 3 Christmases were just so rough. But good. I mean, we got together, we celebrated, but it's like you always know that there's someone not there. And that continues. I mean, we always know there's someone not there, even now. But it's in a different way. It's less of an ache and more of a, gosh, I wonder if they were here. What would they be doing? What would they be saying? What would things look like? And really just kind of going through the day. I think we all internalize that, but we just go through our day and enjoy the people that are there with us. This is probably the last year we'll spend at my parents', so she's still young enough that I don't feel like I need to have her wake up here Christmas Day, be here all day Christmas Day. That'll be next year. But we are going to do a little Christmas Eve thing, Christmas Eve morning, just us. But then Christmas morning, we'll get up, we'll go to my parents', which is what we've done years and years and years, because we don't have kids. All my siblings have kids, and we would go over there. And yeah, just be there at my parents' doing Christmas morning. So we're doing that, and then we're going to go see their little cousins Christmas night, which that's a new thing, and so I'm excited for that. We're gonna go spend a few days with them, and I think she'll be super excited to be with her cousins. So yeah, that's where we're at. That's our update on everything, really. If there's anything that I've missed, feel free to ask. You're always welcome to ask questions. I may make another video about this, like a specific one, because I've been getting this question a lot, and mostly from people who are curious, But I had a lovely soul leave, tons of comments. Please, someone, if you're gonna go that and do that, please go watch the video that I shared about being kind to people on the internet, or just letting things go. Like, it's still all laughable to me, this whole situation. I've had one or two like kind of negative comments left on videos, but I love this community. Everyone is so supportive and kind. But I've had one or two, and when you open yourself up to the internet, that's just what happens. But this is the first time I have had one single person, spent 5 hours of their time going through my videos and watching them and commenting on them, all about the wax, because you can't use the V word on here. So they kept saying the wax. I must have gotten the wax, and how could I do that to my family? And it's all my fault that I am going to be leaving them and have destroyed our family, basically. A lot of comments about that. Basically every video, they left some kind of short comment about, oh, share your wax history. You won't do it, I know. How many tests did you get done? And then my favorite one was from them saying that they hope my husband doesn't leave me, but he probably will. That was left on the video that I made about body image and, self-image after something like this happens. And I almost didn't reply to any of them. I was just like, this is crazy. But I did end up saying, in a very kind of kill him with kindness, a little snarky, but kill him with kindness way, I said, thank you, sir or madam, because I assumed it was a sir, but now I don't know. Their page is literally their sweet dog named Cookie that they love. They post videos of Cookie the dog, Cookie the bulldog. I think it's a bulldog. Anyways, sweet Cookie. I said, thank you, sir or madam, for your, concern. And I only had 2 tests done because they were required in order to go in to see my husband's mother in the nursing home. And speaking of said husband, he takes his vows of in sickness and in health very seriously, and in either way would never leave me over something as superficial as my appearance. I also did not get the wax of which you speak. Not that it should really be anybody's business, but I did not get it. And I thank you for your concern. Have a wonderful day. I think that's about how it went. But I have had a lot of people ask if I was wax-inated. But like I said, most people are just curious. They want to know. And because I know that that's a thing that's going around, with all these cancers. And no, I did not get it. So if that helps answer questions for anyone, there it is. I may do, like I said, a whole video on it. It'll be short because it's just, no, I didn't. But people are just so curious, so I feel like they may want that answer. But I'm going to leave you with 3 things. Be kind on the internet. There are real people behind the keyboard with which you are warrioring. Real people. And this person told me I looked 60. Shame on me for being a Disney mom, so that was interesting. Just all kinds of weird little things. And I mean, seriously, I did. Andrew and I were just like laughing, but some people can't laugh that stuff off. So be kind on the internet. It's the internet. It's a stranger you don't know. A stranger with cancer. Like, what? Anyways, that is not what this video was supposed to be about. So I'm going to stop talking about it now. Just really wanted to give you guys updates before Christmas, or whatever holiday you celebrate. I just hope you have a wonderful one and a happy new year, and I will see you in the new year. So, going to just enjoy the couple weeks with my little family and my sweet little elf and go from there. So, thank you for just all your continued support and concern and prayers and care for us. It really, really means a lot. So, I think that's it. Wishing you all the best. Happy holidays.